Hello, podcast listeners. I'm your host, Jacco Zwetsloot. This is the NKNews Podcast today. It is Monday, May 16th, 2022. Joining me here in the studio, actually, that's not true. Joining me via Zoom are three members of the NKNews and NK Pro team to discuss North Korea's admission of a COVID outbreak and what that means. But first, please leave a review about this podcast on iTunes or wherever you download the podcast and share it with colleagues and friends and even enemies. On Spotify, you can leave a rating but no reviews, so please do that. If you're listening to this on YouTube, please click like and subscribe. Secondly, do go and check out nknews.org, where you will find all the latest in-depth stories written by the excellent journalists joined by me today and many more. Consider buying a subscription for a year. It's much more affordable than you think, and that helps to fund the excellent journalism that my colleagues put out each and every single day. Thirdly, follow us on Twitter. You can find each of our handles in the show notes, and nknews.org is the general one for the whole platform. Now, to introduce our three guests on the round table today, although we're doing it without a table, we have NK News and NK Pro founder and managing director Chad O'Carroll. We also have two correspondents from NK News, Jeongmin Kim and Ifang Bremer. Welcome on the show, everyone.
Hello.
Morning, everyone.
Hello.
Ifang, this is your first time to join us on a so-called round table, so welcome. How does it feel?
Yeah, thank you, Jacco. Yeah, it feels good to be here. Yeah.
Excellent. What was the first sign last week that something was going on in North Korea that was different from previous weeks? I guess, Chad, we can start with you.
Yeah, so we had a source that tipped us off on Tuesday, I believe it was, saying that the capital city had gone into a sudden lockdown. And they're basically, we've seen since COVID broke out in North Korea, short lockdowns of about 24 hours, sometimes when there is particle dust being blown in from China.
Mm-hmm.
And so it was an initial thought that it could be like that, but the source said that there was something rather unusual about this time in the sense that around 2 p.m. There were long lines forming at bus stops in the capital. People were all going home in the middle of the day, which is really unusual in North Korea. And then the source gave us updates throughout the day and the next day. And then we started hearing from other sources that they were also aware of this lockdown and that it did seem unusual. And some people said there'd even been some panic buying just on that day when residents were told to go home. And then, it was after 2 days of them all being locked up in their compound and not being able to go out and being told they can't go to shops, etc. We had the rather stark news break from North Korean state media, which basically said, yes, we do have coronavirus and the capital is locked down. So that's how we heard about it initially. There was a 2-day lag between when people in Pyongyang were being told to go home and them coming clean through state media about what was going on.
Is that lockdown believed to still be ongoing?
Yes, I spoke to sources a couple days ago and it was still ongoing then. I'm waiting to find out if that's still the case in Pyongyang this morning, but I don't see any reason why it wouldn't be the case. Incidentally, there were two different sources on Tuesday last week who actually gave numbers of how long they might be expected to lock down for. One said 5 days, one said 10 days. I don't know if either of those are accurate or if it's just an optimistic take or what, but we know from Shanghai, people were told 4 days and it was just day 60 today. So who knows?
Chad, our listeners may have heard that your audio sounds a bit different, and that's because I'm actually recording your audio because you're doing this on the phone. You're in the car, aren't you?
That's right. Yeah, I'm driving right now across the bridge in Seoul, and I'm going towards Gangwon, which is the island the South Korean island adjacent to North Korea, and basically thought it would be valuable to go to as many border points as possible today.
Yeah.
And just take a look at what kind of things are visible. I did actually do this last week. I went to Odusan, which is the one closest to Seoul, on the day of the outbreak in Pyongyang, or the day of the lockdown in Pyongyang. And I did see people continuing to do their farming as usual, which was a surprise. So yeah, I am expecting to see normal agricultural activities ongoing based on what I've been hearing, which doesn't seem intuitive if they are doing lockdowns. But then again, I've also heard that They're telling worker units to continue their activities as normal, but just not to mingle with other worker units. I don't know how effective that will be against Omicron.
Could it be that the lockdown is only citywide in Pyongyang?
We have also heard Sinuiju this morning in state media is locked down, and a source in Dandong said last night that they had not been able to see any activity on the Sinuiju side of the border since May 12th, I believe.
I can explain a little bit more on what state media has been talking about it on the lockdown.
Yes, please, Jeongmin, tell us. Well,
Right,
actually, first of all, what do they call coronavirus and Omicron variant in North Korean?
So first of all, when they first reported on May 12th, which is 2 days after NK News heard from sources, they said that the first case of stealth Omicron variant BA.2 was from Pyongyang, and that it was May 8th. So there was apparently a 2-day or less lag between when we heard and when apparently it was the case was first tested. And when it comes to lockdown, it seems that the order from the command is that the movements between regions as well as the work, living, and production units are banned. But it seems that within the unit, they're still allowed to go ahead with whatever economic activity they have been doing. And it seems that Kim Jong-un is not willing to sacrifice its economy with COVID anti-epidemic measures, which now he's calling maximum emergency anti-epidemic measures. But I'm not sure if it's that feasible, because if goods and people stop flowing from one unit to another, it will definitely limit how much they can produce. And Kim Jong-un has also stressed that there are construction goals like 10,000 houses in Hwasong that he is saying that should still meet the deadline despite all this crisis.
Wow. Now, also, just back on the language question for a moment there, I understand that North Korea likes the term fever of unknown origin rather than coronavirus, or does it use both?
Right. So in some contexts, they do say COVID, but when it comes to the state media reports about the numbers, they refer to the fever, 유혈자 in Korean. And it seems that the potential reason why they are counting based on that one symptom, fever, could be from the lack of COVID-19 test kit or lack of testing facilities, because it seems now the number of fever-ridden patients is not just in Pyongyang, where the testing facilities are probably focused at.
Currently, is any segment of the North Korean population believed to be vaccinated against COVID?
No. As far as we know, no one in the foreign community in North Korea is vaccinated. Whether there may be parts of the leadership that are vaccinated, we just don't know for sure. There are some rumors, but there's also been reports that you may remember from a year or two ago where there were also rumors that the leadership itself was skeptical about the quality of some of these vaccines. So we just don't know.
Ifang, tell us about some of the statistics that you've been reporting over the last few days.
Yeah, so on Saturday, North Korea reported about 174,000 new cases of what they call fever. On Sunday, they added 260,000 more. And then on Monday, 390,000. So the total case number since end of April would be roughly around 1.2 million cases of fever already.
Okay, wow.
And a death rate of 50 right now.
So 50 deaths are actually reported by the North Korean government. Is that correct?
That's correct, yeah.
Wow. Jongun, you were going to add?
No. Go ahead.
Okay. Are these figures believable, Ifang?
I mean, that's a very good question. We have no way of knowing that. It's a very vague description of what qualifies as a fever case. Is it just having fever, or are there also these known coronavirus symptoms being included? So yeah, we actually don't know. And it seems that North Korea's testing ability is also quite limited, which might be another reason that they're referring to this as fever. But as I said, yeah.
Because, I mean, there are, my limited understanding of this is that a special kind of test is required to identify the exact type of virus, right? So they could simply be going by numbers of people who are showing up with some kind of illness.
Yes, that's my understanding of what's happening right now in North Korea. Yeah.
Right. Now, was the North Korean government maintaining its line that up until the end of April, 0 people had been infected since the epidemic began in early 2020?
That's a good question. Jeongmin, do you know about that?
Jacco, are you asking when they started?
No, I was asking whether
confirming
until this most recent outbreak, North Korea was saying that no people had ever been infected with coronavirus.
Right, that was a pride point from North Korean regime's point of view that nobody officially was infected from COVID. If you remember, one of military parade speeches in the past few years, if you remember the Kim Jong-un speech where he shed tears, that was when he thanked his people for staying healthy during COVID and so on and so forth. And very recently also, they maintained that position. But also, if we see state media, they do not exactly say a date when the fever exponentially was seen in Pyongyang and in other counties, in other cities. And late April, it just really it's in line with when they held the very big military parade where people were seen not wearing masks on April 25th.
Right. They had that big parade that we, of course, live streamed on YouTube. People can still go back and look for that. It's my understanding that there have been no international flights into or out of Pyongyang for a long time. Is that correct, more or less?
Yeah, that's correct. Since the last international flight was in March 2020, when there were a delegation of diplomats leaving North Korea and 3 or so Russians arrived back.
Okay, so that's been more than 2 years. So how do we imagine this outbreak came to Pyongyang? Jongun, is it basically that it was the people brought in from around the country to participate in the parade are believed to have brought the virus with them?
I really must say that this is really tea leaf reading at this stage, because the testing tracking, it's very different environment in North Korea. They don't release the exact contact tracing methods like other parts of the world do. But I can imagine that there could have been some cases near the border, although the border was strictly locked down. And during the parade, there were other region people that came to that were invited to the military parade in Pyongyang. So that could have been the spreader event. But the bottom line is we don't know.
We don't know. Chad, just to check on your schedule there, what time are you likely to arrive at Ganghwa Island, west of Gimpo?
I think we're not that far away from it right now, but the part we're going to start is probably not for another hour, I'd say. Yeah, about an hour from now.
Okay, well, unfortunately, we won't be able to follow that on this particular podcast, but we look forward to a story from you in the coming days on NK News about what you've seen there from Ganghwa. Ifang, back to you. How is North Korea tackling this outbreak?
Yeah, first of all, I think we should add that throughout the pandemic, there have been rumors of coronavirus being present in North Korea. Again, there's no way of knowing that for sure, but the current outbreak, I think, really shows that even with probably the most strict border lockdown in the world, there's just no way of stopping this virus from coming in. So what's interesting is that on Saturday, the Nodong Shimun state newspaper included what seemed to be a list of treatment instructions, which included very basic things like rinsing with salt water, eating yogurt.
Rinsing what, the inside of your mouth?
Yeah, that's right. And mostly antibiotics to prevent bacterial infection on top of the virus. All in all, very basic methods, it seems, which is also quite worrisome.
And they've called out over 1 million North Koreans, I understand, from the headline of your recent story, Ifang. Tell us more about that.
Yes, that's right. So they say they mobilized 1.3 North Koreans, both military and non-military, to help prevent the spread of the virus. It seems that they are locking down neighborhoods and sections and also places where people work so that the work can somehow continue. but it's all still very vague. It seems to be also kind of panicky. On Sunday, party officials reportedly started donating spare medicine amid efforts to supply.
What, just any kind of medicine?
Just any kind of medicine, it says in the Northern Shimun, to supply all parts of the country with sufficient medication. So yeah, the situation seems to be quite dire at this moment.
Are they basically following the Chinese method as far as we can see?
Yeah, well, one thing also that was reported in the Northern Shimun this weekend is that Kim Jong-un recommended officials to learn from other countries and in particular China. Yes, that's right.
Jeongmin, you were going to say? Oh, sorry, Chad.
Yeah, Jacco, for any lockdown to work in North Korea, if they're going to learn from China, they'll be needing to do a lot of testing. And it seems there's not much testing capacity, which therefore means they won't really know when it's safe to let residents out from certain areas back into normal life.
Right, as you said, it's a blunt instrument if all you can test for is fever. Jongun,
exactly.
Has South Korea offered any vaccinations or antiviral medicines?
So far, there were some talks about it. The new South Korean president Yoon Suk-yeol, through the spokesperson, he seems to have been suggesting that we can help North Koreans with assistance on COVID-19 vaccines or treating the already infected patients. But it seems that there has been no announcement on any formal offer to North Korea through things like inter-Korean hotline. But yeah, there were some talks about it. And the United States said that there's no plan to share vaccines with North Korea in a bilateral sort of way. But if the COVAX decides to send some of the Pfizer vaccines that US already donated, they'll be on board. But primarily they were faulting the North Korean regime for putting their people under peril by not taking international aid so far. And just to add on to Ifang's point about the medical donation from the party officials in Pyongyang, it also could be part of their propaganda methods as well, because even Kim Jong-un, who started wearing masks, he also made a big deal on donating his own reserve medicines prepared by his family, according to state media, and suggested to the party committee to send Kim Jong-un's medicines to families in difficulty, according to state media. And of course, many state media articles about the North Korean COVID-19 countermeasures say that no other capitalist countries are like this, and that the General Secretary Kim Jong-un is being very generous with sharing what he has to the people. So this is part of their propaganda methods as well. And about the medicines,
but just to reiterate there, the medicine that Kim Jong-un is donating, we don't have any evidence that he's donating medicine specific to COVID, do we?
Yeah, we do not know what kind of medicine he is donating. But if we see the folk remedy articles that Ifang was referring to, they also mention what we consider as over-the-counter medicines, like ibuprofen. But I actually wanted to ask Chad about this. If the 장마당s are closed, like the markets on the street, that isn't so over-the-counter anymore, isn't it? Like ibuprofen in North Korean setting.
Yeah, well, one of the big problems in North Korea since the outbreak of COVID has been the absence of medicine, just even regular over-the-counter stuff. The Russian ambassador actually complained about this publicly about a year ago. The train deliveries that took place this year are probably have replenished supplies somewhat, but whether that's trickled through to cities and towns in far-flung regions is unclear. So yeah, I would say that even Tylenol and things like that are probably in relatively short supply. And then when you think about things like ventilators, if people get really sick, I doubt whether they have many of those at all.
Yes, ventilators and also an oxygen tanks, one would imagine, would be in short supply there.
Right, and some of the sanctions exemption through 1718 Sanctions Committee, there were some ICU-related goods and COVID-19 test kits and so on and so forth that was pledged, exempted in the past 2 years, but I'm very doubtful that any big bulk of these actually went into North Korea.
What would it feasibly take to vaccinate most of the North Korean population, even at this late stage?
huge deliveries of vaccine. Depending on the type of vaccine, you might need quite significant cold chain infrastructure, and you need time, right? Because a lot of these vaccines require 2 or sometimes more jabs, and there are numbers of days you have to wait in between each one. So it seems like it's far too little, too late. The only positive I think you can say from all of North Korea's situation is, remember Omicron broke out in South Africa first, and the impact in South Africa was not too severe because South Africa has a mainly young population, and North Korea also has a pretty young population. So that may help in terms of just natural defenses against the very worst of this.
Yeah, so according to Dr. Key Park, who has been monitoring the situation very closely, he has been arguing that vaccines like AstraZeneca, if there are any big doses going into North Korea, it may work because North Korea already went through some epidemics and they do have similar cold chain systems that may work in some part of the countries, including the capital. But remember how United States over the weekend was like, if we already donated Pfizer to COVAX, and if COVAX sends it to North Korea, we're on board. But Pfizer's mRNA, and mRNA requires much more complicated cold chain system. And without the help on those equipment, it will be very difficult to administer mRNA vaccines to North Korea.
Gosh, what are the possible knock-on effects of a real full-blown outbreak of the coronavirus in North Korea in terms of, I guess, food production or local instability or anything like that?
Yeah, I mean, it could be, if it really rips through the country and they do start having to do Chinese-style lockdowns everywhere and people can't go to work, that obviously has a huge economic impact. Then you've got the agriculture, the farming. If people can't farm, it's the end of rice planting season right now. Then when harvest comes later in the year, that's going to obviously be another big problem set. If political elites start dying, especially, we do know there are a lot of elderly within that cohort, then that could translate into political displeasure. And just in general, in terms of the general population, I mean, if we do see a sizable number of people dying, then this is probably going to be the worst humanitarian crisis since the famine, and it could even be worse. I think it really just all depends on what I was saying earlier, like how much of a factor does the relatively young nature of their population play into the level of death and public health problems compared to the rest of the world.
Yes. Now, I think, Ifang, you reported that there was an elderly member of Pyongyang's elite that died quite recently, and Kim Jong-un went to his funeral. Is that correct?
Yes, that's right. Young Hyun-sop, one of the oldest members of the North Korean elite, died at the age of 96 this weekend. But state media did not mention COVID-19, claimed passed away of a stroke. So,
It's certainly possible at 96, isn't it?
It is, yes.
Yeah. Tell us about Kim Jong-un's appearance at his funeral beer.
Yeah, I mean, it seemed to, there was a picture included in the newspaper, and there seemed to be many people around. There was a musical band, all without masks, and Kim Jong-un himself was wearing a black mask of what seemed to be a bit of a higher grade than what he has been wearing previously. So it seems that he's still surrounding himself with many people. So yeah, that's noteworthy, I guess. Yeah.
Is this the first time that we've seen Kim Jong-un wearing masks in public?
As far as I know, yes. Jeongmin?
Yeah, I also think that it's the first time.
Well, it'd be interesting to see how this changes in the coming weeks. Now, lately we've been reporting on North Korean missile tests and also the possibility of even a nuclear blast test coming up in the near future. Just remind us, Jeongmin or Ifang, were there tests last week also?
Right, so I can explain this part. This was Thursday evening. Evening missile tests are very rare, but it was also notably the same day as when they reported the first COVID-19 case on state media. And North Korea did not end up reporting on this missile test later on, but South Korean military said that North Korea fired 3 short-range ballistic missiles towards the East Sea. That was the flight range 360 kilometers, altitude 90 kilometers. It does sound like multiple rocket launchers. It could also come from how this administration, compared to the previous Moon administration, is more willing to publicize the politically lower level the missile test to the public. But yes, it was, if we count it in, it was the 15th missile test event of the year. And it was the first in South Korea's Yoon Suk-yeol was sworn in as president.
Yes, that's right. He hasn't even been president for a week yet, and there's already been some short-range ballistic missiles tested. We've been talking about the possibility of a nuclear test, particularly looking at activity up in the area of Punggye-ri, where there is a tunnel system that they've used in previous years. That tunnel system was blown up, but they were believed to be reinforcing tunnels again or something like that. Can you correct my ailing memory?
So you're right. And people like the former chief of South Korea's intelligence agency, Park Ji-won, has been confirming that the Tunnel 3 of that site has been being restored, and other OSINT communities have also been talking about it. And according to Park, it could be something like a testing of a miniaturization of a lighter weight nuclear weapon, something like a tactical nuclear weapon test.
And what I think is interesting is that last week experts told us that even though North Korea is going through such a big crisis right now, that doesn't necessarily mean that they will not conduct missile test or even a nuclear test, perhaps even as a way to reassure the people of the country's strength despite COVID. So I think that's quite interesting.
I do think that's a question worth exploring. How could this outbreak of COVID affect North Korea's political calculus in deciding whether to charge on ahead with these tests or to rein itself in? On the one hand, Ifang, you point out that, domestically, it could send a message to its people that everything is normal and we're not going to let this stop us. But on the other hand, would donor countries and organizations not be likely to show less empathy to North Korea if it conducts or prepares to conduct a nuclear test?
Yoon actually said exactly that. Not Yoon, but Yoon's top aide, Kim Sung-han, who is now head of the National Security Office, that the meeting strongly condemned North Korean missile tests, and the primary reason was a quote-unquote dualistic attitude because the country is going through COVID-19 crisis, and they are using this political capital on missile tests. But then, to Ifang's point, I think that could also backfire, wouldn't it? Because although the intention might be that they are trying to boost people's morale by testing more weapons and potentially nuclear weapons during the COVID-19 crisis, if it wouldn't look that well to some of the population who's going through crisis.
That's right. I mean, of course, it's impossible to project our thoughts onto North Koreans, but surely at some stage, most people would think, why is my government so concerned about testing nuclear weapons and missiles when here we are looking for vaccines and medicine that they can't get to us?
Well, just don't forget, though, that the 3 last missile events have not been reported on in domestic state media, so they might not know about missile tests. Presumably, they would report on nuclear testing in state media. That's always been a big sort of proud moment. But frankly, we've never had 3 missile test events in a row where they've been quiet about them. And it's also possible that they're shifting how they play these missile tests in terms of presentation in external facing media. One school of thought is that they don't want to embarrass China too much with nuclear tests and missile tests, while Chinese senior representatives like Liu Xiaoming have been touring the world, trying to talk to different partners and stakeholders and calling for North Korea sanctions relief. I don't know the reason they're not making noise, but maybe that's the start of a new strategy with regards to testing. And it could even be down to what we've just described, there being concern within even the propaganda apparatus that it's not a good look to be going through a COVID situation and trumpeting missile tests on the front pages of the Rodong Shinmun.
So, Chad, what do you think about the political calculus of North Korea regarding specifically a nuclear test and how that might be affected by this outbreak?
Well, yeah, it's a good question. I mean, when it comes to the timing of the nuclear tests, they've missed one obvious political milestone, which was Yoon's inauguration. There's also Biden's forthcoming visit for the summit in South Korea. That could be another opportunity. And then there's US Memorial Day towards the end of May. Those kind of dates have always been good in North Korean terms for holding for launching missiles or for detonating nuclear devices. But I've said this on Twitter the other day, after the plenum of December 2019, when Kim Jong-un basically gave up on diplomacy with the US or trying to get sanctions relief, I really think we've seen a change in how North Korea looks at these tests. And the 5-year plan, which came out in January 2021 at the 8th Party Congress, which included these really wild military modernization goals, I think that the timing is basically for all of these forthcoming tests is probably being driven by that 5-year plan, first and foremost. And political considerations are actually much, much lower on the decision-making calculus than they were in times past. And the one way we'll know if this is true or not, what I'm saying is whether or not we see North Korea use Biden's visit to test a nuclear device, or whether he goes for Memorial Day. In the past, he would have done that because there would have been some political leverage, and it could be, currency and negotiations. But I really just think the North Koreans don't care about South Korea or the US anymore.
Let's talk a little bit about Biden's upcoming visit. I believe he's set to come. We're recording this on Monday, the 16th, and he's expected to land in Seoul this Friday, the 20th of May. Am I right on that?
Yep.
There's obviously a lot for the United States and South Korea's new president, Yoon Suk-yeol, to talk about, but I can only imagine that North Korea's got to be pretty close to the top of that list of priorities.
Yeah, I'd say so. Jeongmin, you've been tracking this closely. Any thoughts?
Yes. What's the signaling or messaging coming out of the US and South Korean governments, Jeongmin, ahead of this first summit between the two leaders?
Well, from North Korea or?
No, from South Korea and the US.
Right. So there hasn't been any on-record briefings where they talked about the exact topics, but over the weekend, it seems that a government official gave a back briefing, and they have been saying that there would be 3 main topics of discussions likely between Biden and Yoon. One is North Korea, of course, but it seems like it's focused on the weapons development. Second would be pressing international affairs, which to me sounds like something about Ukraine or including Ukraine issue. And thirdly, the supply chain and what Yoon calls the economic security issues.
Okay. Oh, there's certainly a broad range of things to be talking about.
Basically everything. Yeah.
Right. Basically everything. Right. But certainly with this outbreak, going back to the numbers that Ifang quoted us earlier, we've got 1.3 million people infected in, let me be careful with my words here, 1.2 or so million people reported to have been infected with COVID in North Korea in the last week. I think that would certainly come close to the top of the agenda there in terms of pressing matters and what to do about whether to send, just to drive trucks up to Kaesong industrial zone full of vaccinations, leave the keys in the ignition, and just let the North Koreans take care of it from there.
Actually, this will be, I think, a very important testing ground for, from North Korea's point of view, maybe on both US and South Korea, because since even during the Moon administration and similarly under the Yoon administration, they have been reiterating their principle that the humanitarian issue should be separated from the political or military matters. But so far, we did not really have that kind of situation, like a pressing situation where we sort of have to decide whether or not to do the 2-track approach towards aiding and deterring, right? So I think it will be something difficult and very important to strategize between the allies.
And I guess it's also worth highlighting just the stark difference between the two Koreas in how the coronavirus outbreak has been handled since the beginning. In South Korea, the largest surge of outbreaks didn't occur until early this year, when we had hundreds of thousands of people infected every single day. As of yesterday, the number of infections was down to 25,000 people per day, with 48 deaths recorded for yesterday, and a total number of deaths in South Korea since COVID began in early 2020 of 23,709 people, which is for a population of South Korea is remarkably small, looking at some of the numbers worldwide. And South Korea also has a vaccination rate of very, very close to 87%. So I mean, the tragic reality is that at some point in the future, South and North Korea will be a really interesting scientific test case for two extremely different ways of battling a pandemic.
Yeah, and unfortunately, though, we probably will never get any reliable data from the North Korean side, so it will be hard to compare. And though I was mentioning earlier about how North Korea has the benefit of a younger population, we should not forget there is also a lot of older people there, and as you said, they are having existing underlying health conditions. There's malnutrition, and so when you look at what happened in Hong Kong amongst the unvaccinated elderly population, it was like real devastation, highest per capita death COVID, I think, in the world. And so that could give a taste of what happens in North Korea amongst that older at-risk populations. So it is a pretty grim outlook from now, and it does seem that the North Koreans are not very well prepared to deal with this. And given they want to keep the economy going, they're making compromises already on, it seems, the very strict Chinese approach, which hopefully this border visit I'm doing right now will shed a bit more light on whether they're doing this flexible approach also in the border.
Yeah, Ifang, the information that we're getting out of North Korea right now, that's just from monitoring North Korean media, isn't it?
Yes, that's correct. And actually this morning, if we can just go back to talking about medicine supply for a bit.
Yeah.
Kim Jong-un ordered the mobilization of soldiers to stabilize the medicine supply. That's just from today. And
what does that mean?
What it means is that Kim Jong-un seems to really focus on having pharmacies open 24/7. And he's criticized the fact that that has not been possible so far. And correct me if I'm wrong, but there seem to be primarily relying on a medication called interferon alpha 2, which is an antiviral medication which seems to be discouraged by the US government to use for COVID. But maybe there's some doctors listening to this podcast who can, maybe send us some information about that.
Ifang, do you remember, just in terms of Kim Jong-un and maybe being focused on pharmacies being open 24 hours. Ifang, do you remember those photos I shared with you that we couldn't publish last week of inside a North Korean hospital near the South Korean border? Those photos were taken in a couple of years before the pandemic, so technically in the good times. And what you saw is really very harrowing scene of rusting operating tables, a huge lack of medicine, no running water, no inpatient capability. It looked really, really grim. So I don't see how keeping pharmacies open 24 hours would be some kind of silver bullet with regards to the outcome of this potential tragedy.
I'm just wondering how practically, even if you have a pharmacy open 24 hours a day, if people are under lockdown, how are they supposed to get to them?
Right.
Exactly.
That's a good question. Yeah.
Right. And also, if they are lucky and there are units involved, that pharmacy nearby, maybe they're lucky. But it seems like with the lockdown measure and the primary focus on keeping the pharmacies open, it just sounds very ironic to me, honestly.
Yes. To come back to my earlier question, Ifang, that the information we're getting is just from monitoring North Korean media. Has North Korea has the government of North Korea actually made any external statements? For example, has it sent any message to the World Health Organization or to Gavi or COVAX or any other international body at all?
So the latest information from the World Health Organization is that they say that they're in touch with the Ministry of Health officials of the DPRK, but they haven't received any official report yet about confirmed COVID-19 cases.
I see.
And actually, the WHO told us that they reviewed and approved a pretty extensive plan to make the DPRK eligible to receive vaccines through COVAX.
Yeah.
But North Korea has not replied to that.
Right. And previously there were two offers to give vaccinations that North Korea turned down, right?
Three.
Three.
Yeah.
So there were AstraZeneca vaccines that were pledged through COVAX, and there was Novavax that a country bilaterally pledged, and there was also Sinovac from China. For China, Sinovac, North Korea, I should say, politely rejected, saying that they would rather have it go to countries that need it more, but that's their just polite way of saying we don't want it. And AstraZeneca vaccines, there were a big dose pledged, but after a while, after North Korea continued not to take them in, I think late last year, the cycle ended. So COVAX had to redesignate it to other countries. And Novavax also, it became 0 doses at one point. It seems they did not really respond positively.
It really makes you wonder why they're so reluctant to take these vaccines. And from the news that's coming out of state media right now, it just seems like it's too late anyway.
Yeah, when I was talking to various sources that know the North Koreans quite well last year about this kind of question, a lot of people said that the way North Korea sees this coronavirus situation is it's really a national security threat, and as a result there's huge suspicion about any inbound goods or donations or visitors that come into the country. There were fears, it was suggested to me, that people may deliberately bring the virus in clandestinely amongst humanitarian cargoes, etc., and that was basically one of the reasons they didn't want any outside help. It's quite an extreme theory. I don't know if it's accurate, but it certainly sounds like the way North Korea's Ministry of State Security might approach problems.
Right, that ultimately becomes a security issue. Last question to you all. What things will you be looking to see in the next couple of days?
Number one for me is just hearing from sources in Pyongyang whether there's any sign that their hard lockdown is ending soon. Number two, whether at the border today there are signs of the lockdown being expanded to rural areas. Those, I think, would be two interesting indicators. And of course, the daily updates of caseload data that the North Korean state media has been publishing.
Right. Jongun?
Yeah, I was just going to add, I'm trying to verify this, but it seems that per one report from Chosun Biz, it seems that the unification minister, Kwon Young-se, he seems to have said that the reason why North Korea hasn't been allowing the vaccination, part of the problem was that when the companies are aiding vaccines, there are some issues with taking responsibility, basically, when there are side effects. But they have been asking to get exemption from it, considering the very particular situation this is with COVID. But North Korea hasn't been agreeing to that. But I couldn't verify this independently.
And Ifang, what will you be looking for?
I'll be curious to find out if North Korea is going to respond to any of the international aid offers, either from South Korea or the WHO, and also state media updates about, medication. Excellent. It's very important.
All right. Well, we'll certainly be following that here at NK News. Chad, any story that you write today or tomorrow about the what you're seeing up along the border, I'll have put in a request to have that added to the show notes so that people who are listening to this podcast can click on that and go and read the story after listening to this.
All right. Yeah, thanks.
All right. Thanks to Chad O'Carroll, Jeongmin Kim, and Ifang Bremer for joining me on the podcast today. Ladies and gentlemen, if you already have an NK News account, and if you're a think tank, business, or academic institution, take a look at NK Pro. Our NK Pro platform offers unparalleled services specifically catered to the needs of professionals who monitor developments on the Korean Peninsula. You can inquire about access or a free trial at membership at nknews.org today. Thanks, as always, to Arias Dare and Brian Betts for facilitating this podcast, and to our post-recording producer genius, Gabby Magnuson, who cuts out all the extraneous noises, awkward silences, bodily functions, etc. Thanks, and listen again next time.